Nikki. My name is Essence, and I'll be your nurse today from 7 a.m. to 7 p.m. How are you doing today?
I'm good, a little tired.
Oh, you're tired. Did you get pretty good rest last night?
For the most part of being in the hospital, yeah.
Yeah, your nurses were coming in and out all
Yeah.
night. Yeah, I'm so sorry about that. But I'm going to take good care of you this morning. So let me make sure that your 3 side rails are up, your call light is near, your bedside table is right here, your bed is locked, it's at the lowest position, and your floor is clutter-free. Okay, everything is good. So, Mr. Nikki, can you give me your first and last name?
Dennis Zanicki,
Okay. And how old are you?
59.
59. Okay. Do you have any known allergies?
No.
Alrighty then. And your MRN number is 7745-737. 7745-737. Okay. Alrighty then. So everything matches. So per provider's orders, I am here this morning to give you your Lasix via IV push. And you are supposed to get it right now as we speak per provider's orders, and you're getting 60 milligrams. So let me gather up my materials. So I have my medication, my syringes, and everything. Look in your bar to see if everything is correct. So I have Dennis Nikki, and he is to get furosemide Lasix injection, 60 milligrams via IV push right now, and it expires September 1st, 2028. Okay, so everything matches. So now I'm gonna go into action, and I'm gonna scan your bracelet. Scan your bracelet, and now I'm going to scan your medication. Alrighty. So now I have everything scanned up, and I'm going to apply some gloves so I can pull up your medication, okay?
Okay.
So your furosemide is basically a diuretic. It's a water pill to release some of that fluid off of you and to help control your hypertension. So first I'm going to clean my medication vial for 30 seconds. 30. So I clean for 30 seconds. So I'm gonna let that dry. I'm gonna cap my needle, and now I'm gonna give air. Well, take this off, and I'm gonna give air 6 milliliters because I'll be giving you 6 milliliters of medication this morning. Okay. So now I'm gonna give air. Alright. Now I'm gonna pump it. I don't know why this thing wants to with me today. Okay, now I'm going to check for any air bubbles. Okay. Alrighty. And now I'm going to safely recap my needle. And now I need to label my syringe to make sure that I don't get it mixed up with my flushes. Okay. Alrighty, here's your Lasix. Alrighty, and my flushes, have my medication. So now it's time to put in work. Alrighty, Mrs. Nikki. So I'm gonna take a look at your injection site. Make sure that this is closed. Okay. So Mrs. Nikki, I'm gonna take a look at your injection site. Do you feel any type of tenderness when I touch it?
No.
Are you in any type of pain?
Nope, not at all.
Okay, I don't see any redness or anything, so everything is good. So now I'm just gonna I'm gonna make sure that your IV site is patent, so I'm gonna do a slight little flush. Okay, we already have this tab on here, so I don't have to use an alcohol swab. So I'm just gonna flush it just a little, just to make sure that it's patent. Okay. Do you feel any pain when I do that?
No.
Okay. Alright. So like I said before, your medication is the furosemide, the Lasix. So we are going to push this in for a record of like 3 minutes to make sure that you don't have any type of adverse reactions or we don't rupture any blood vessels, okay?
Okay.
So just bear with me for a moment because I kind of know that 3 minutes is a long time.
That's okay.
Let me get my clock here so I can make sure we have an adequate amount of time. Okay. So the furosemide is basically, like I told you, to help lower your hypertension, and we want to make sure that you are taking your medications regularly to make sure so you have like an adequate and a good, you know, effect of the medication. And at home, you want to make sure that you do monitor your blood pressure and your heart rate when you're taking this medicine, because it can lower your blood pressure too much, and you know, you might bottom out. So we want to make sure that your vital signs are pretty normal when you're taking this medication.
Will you teach me the correct way to monitor my blood pressure?
Of course, we're going to teach you the correct way to monitor your blood pressure. I mean, it's fairly easy. You just apply the blood pressure cuff. And, you know, you're just going to press, you know, the pump or whatever. And if you do have a living caregiver, they can do it manually. So we'll teach, if you have a caregiver, we'll teach you and your caregiver how to administer it, okay?
Okay. And what kind of things can cause my blood pressure to drop?
For one, the medication can drop your blood pressure. There's a such thing as orthostatic hypertension, which basically when you stand up or like you move or make a sudden movement, it can lower your blood pressure instantly. So like it can cause dizziness and nausea and everything. So you want to watch out for that also.
Okay.
And another side effect of this medication is the potential for hypokalemia, because your since this is a water pill, it's gonna excrete all of your electrolytes, including the hyperkalemia.
So what is
the potassium?
Okay, so it's potassium
Yes,
is what
potassium.
it is?
It lowers your potassium levels. So while taking this medication, you want to make sure that you eat foods that are rich in potassium.
So like bananas are good?
Yes, bananas are good. That's my favorite kind of fruit.
Mine too, and they're easy to get and
Yes,
cheap.
very cheap. Okay, we are almost done with your medication. Those 3 minutes went by very, very, very fast.
They did.
Okay. So we are getting close to the end of putting in your med. Okay. So like I said, we will teach you how to administer your well, check your blood pressure, not administer your blood pressure. So now I'm gonna flush 6 milliliters. We have another 3 minutes to go. I'm so sorry.
That's okay.
So now I'm gonna flush for another 3 minutes. Make sure. Okay. So was any of the information that I gave you, was it helpful?
It was very helpful because now I know that I have to monitor my blood pressure and make sure I eat high potassium foods and make sure I don't move too quickly.
Yes. And while you're at home, you also want to monitor for any weight gain, because this allows you to retain sodium and water from time to time. We want to make sure that you're not retaining too much, so you need to monitor for weight gain. And if you don't have a scale at home, we can provide you with a scale, or you can just order one offline to monitor your own weight.
Does it matter what I weigh myself in, like clothing wise, or?
You want to have at least like the lowest amount of clothing on as possible, so you can get it as accurate, as possible.
Can I wear something different each time?
Yeah, you can wear something different each time, but just make sure that it's not too much clothing on you.
Okay. So what kind of nurse do you want to be?
I want to work in the NICU, the neonatal intensive care unit.
Oh, wow.
Yes, I want to work with the little itsy bitsy babies.
Have you always wanted to do that?
Yes, I've always wanted to work with kids. I wanted to be a pediatric nurse, but I felt as if, I don't know, I think that that'll be too close to, I don't know. It's kind of weird, but I feel like I would rather work with babies than kids of all ages.
Okay, that's understandable. Are you enjoying nursing so far?
Yes, I am. I am really enjoying nursing. And you're almost done with your med. I am enjoying nursing. There's so many things that I have gotten to do so far that I didn't think that I was gonna, even end up doing like this soon, but I do enjoy it.
That's good.
And I'm so grateful to have you as a patient. You're doing so good today.
And you're an awesome nurse. Thank you.
Thank you. Okay, we are done with your medication.
That went by fast.
It did go by fast. I'm going to recap this with the green needle. The green cap. And now I'm going to recap everything else. So do you feel any type of, nausea, any dizziness right now?
No.
Okay. Alrighty. So I'm glad that you are feeling well. I had to clamp your IV port back. I'm glad you're feeling well. I'm so glad. And I'll be back to check on you and to make sure that I check your vital signs, your blood pressure, your heart rate, and everything. And we're gonna come back to do more patient education with you, okay?
Okay.
Alrighty, thank you so much for allowing me to give you your medicine, okay?
Thank you.
I'm gonna dispose of these in the sharps. And I'm going to take off my gloves. So your bed is at the lowest position. Your bedside table is near. Your call light is right here. Your floor is clutter free. Your bed is locked and your 3 side mirrors are up. I'm going to make sure that I document that your medication was given and it was tolerated very well. And I'll be back in about 15 to 30 minutes after I check on my other patients to take your vital signs, okay?
Okay.
Alrighty then. Thank you so much.
Thank you.